Nails, and hair of the integumentary system provide a barrier between the environment and tissues and organs within the body. The skin is the largest organ in the body. It absorbs nutrients, regulates internal body temperature, and eliminates waste. The epidermis is the outermost layer of skin that provides a barrier between the body and the surrounding environment. The dermis is the middle layer of skin. Sensory nerve receptors in the dermis respond to touch and pass signals to nerves of the peripheral nervous system. Sweat glands reduce body temperature by releasing sweat. Sebaceous glands produce an oily substance that lubricates skin and provides protection from bacteria. Blood and lymphatic vessels in the dermis supply the skin. The hypodermis is the deepest, fatty layer of skin tissue. It is in contact with the muscles underneath it. Soft tissue organs in the body repair injury through a multi-step process that begins as platelets from torn vessels work to form a mesh-like clot that prevents blood loss. Inflammation in the area occurs as tissue repair begins in the damaged area. Mast cells release histamine that dilates blood vessels and increases blood flow to the repair site. White blood cells, called neutrophils, and macrophages work to consume bacteria and remove damaged tissue and debris. As bacteria and dead cells are removed, the proliferative phase of wound healing begins. Fibroblasts build new tissue by secreting collagen that takes the shape of the original tissue. During remodeling, the final phase of wound healing, the tissue created by the fibroblasts matures and regains its normal function.